City of Hoover this afternoon for this very important event. We know that COVID-19 has racked our nation, and we are very excited about what this site is going to mean for all residents of the state. And we are especially honored to have the U.S. Surgeon General, Dr. Adams, here with us this afternoon. So at this time, we're going to get started. Is everyone good to go on a mic check and a white balance? We're all good? Okay. At this point, we're going to go forward with our guest speakers.
Good afternoon, everyone. My name is Dr. David Hicks. I'm the Deputy Health Officer of the Jefferson County Department of Health. This is a very exciting announcement that we're making here. So this is a surge testing apparatus that we have set up here. Behind us, what you see is here at the River Chase Galleria in Hoover. We've already started doing some testing this morning, and we have this site and another site in Jefferson County that we're really excited about. So the Sears parking lot is where we're doing this surge testing for COVID-19. Starting Monday, we'll be doing testing at the Center Point area. That's the Cathedral of the Cross AOH Church. The testing is from 9 a.m. to 5 p.m. And one of the things that we want to really make sure that people are aware of is that you don't have to have an ID to get tested. You don't have to have insurance. This is a kid-friendly site. We have a lot of things for our kids. We're going to be giving out masks. As you can see, we're giving out stickers. This really exciting. We're going to make it fun and interactive for our youth. It's not scary. So this is a nasal self-collection site. What that means is you will gently insert the swab up your nose, not really deep at all, no pain at all. For parents, if you're concerned about your children may do the same thing, you can actually do and assist your children doing the self-collection method. Really important, we need everybody to go to doineedacovid19test.com. doineedacovid19test.com. That is a site where you have to register to get the test. Now, what's going to happen is when you register, you have to print out a voucher, and then you bring the voucher to the site. Now, if you don't have a printer, you don't have the ability to print out a voucher, when you come on site, we can print out a voucher for you. We want a lot of people to come here. We're looking at trying to get at least 1,500 people per site. And I mentioned the 2 Jefferson County sites. There's also going to be a site in Tuscaloosa, and that's going to start on Monday as well. And so everyone needs to go online right now. Stop what you're doing after this news conference and sign up. So I want to thank some of our key partners. So first, I want to start with the Jefferson County EMA, the Emergency Management Agency, and our Unified Command Team, the Jefferson County Commission, the City of Hoover, who's hosting this site here, the River Chase Galleria, the Cathedral of the Cross AOH Church in Center Point, the Jefferson County Sheriff's Office, and all of our state partners, the State Health Department, the State EMA, and the Department of Health and Human Services, who have brought the resources here to us. The Jefferson County Department of Health and our staff have been working tirelessly for the past few months under the leadership of Dr. Mark Wilson, our health officer. The public health professionals that we have are considered superheroes, and we are indebted to them. They're the ones who behind the scenes do those thankless jobs to help decrease the risk of COVID-19 spreading through the community. Last comments I want to make. About 105 years ago, here in the Birmingham metro area, we were experiencing a typhoid epidemic. We sought out to get help from the United States Surgeon General, who sent down a team of 2 people. One person was to help us find strategies to decrease the effects of typhoid fever in our community. The second person that was assigned here was to help us organize our public health infrastructure so that we can organize how we're going to really respond collectively, and that birthed the Jefferson County Department of Health. So 105 years later, we have a Vice Admiral, U.S. Surgeon General Jerome Adams here offering additional assistance to our local community. So we are very pleased and excited about that. So please take advantage of this resource, and we're looking forward to continuing to serve the community.
Good afternoon. My name is Brian Hastings. I'm the Director of Alabama Emergency Management Agency. And on behalf of Governor Ivey and the state of Alabama, I want to welcome the Surgeon General to Alabama. It's great to have you here, sir. We enjoy a very, very close relationship with our FEMA Region 4 and HHS partners. And this is truly a great example of the teamwork that it takes to fight a national emergency, a public health emergency, together. Doing things together, rowing in the same direction to make sure that we're doing what it takes to reduce the spread of COVID-19. And I want to thank the Surgeon General and the team at HHS, FEMA, our state partners, and especially the locals for truly executing what the federal strategy is in emergency preparedness and response, which is federally supported, state managed, and locally executed. And that local execution is where the rubber meets the road. It's where the hard work begins, and it's really the work that happens to put this on. And I really want to take this time to thank a few entities that have put this on. First of all, for the folks that aren't here in Tuscaloosa, the mayor of Tuscaloosa, the city of Tuscaloosa, and the county EMA director, thank you for your support in the third testing site. And here to the locals, to the county EMA director, to the county commission, to the county public health of Jefferson County, and then especially to the hosts of this site in Hoover. Thank you so much for your support. The Surgeon General did mention that our numbers look pretty good, and actually they have come down in the last 4 weeks, and that's promising. But our rates, our normalized rates, are still concerning. So this isn't over. We are still in this. And the only thing that we have available to us without a vaccine to reduce the R0, the transmission of COVID-19 and the coronavirus, are non-pharmaceutical intervention. It's those simple things that all of us can do, and we have been doing them, and I want to thank you for that. Washing our hands, not touching our face, watching our distance, and wearing a mask when you're close to others and social distance is an issue. And if you're sick, please stay home. And today we celebrate the efforts of a whole of government and whole of society effort to do surge testing across the central portion of Alabama to help combat COVID-19. So thank you to our federal partners, to our state partners, and to our local partners, volunteers, first responders, and our public servants who are putting this on today. Thank you.
Hi, good afternoon, everyone. Thank you so much for joining us today. I'm Scott Harris. I'm the State Health Officer. We are really honored and privileged to have this visit here today. And on behalf of the state of Alabama, I'd like to welcome the Surgeon General, Dr. Jerome Adams. Dr. Adams has done a tremendous job in his work as part of the President's Coronavirus Task Force, and I believe literally you've been on TV every day for 6 months, and I just want you to know how much we appreciate what you do. We're very grateful to the messages that you continue to send, the messages that we also are trying to send to people in Alabama about the importance of distancing, about the importance of face coverings, about the importance of sanitation and hygiene, and all those messages that we have been trying to get out for so long. We have seen some improvement recently. I certainly want to recognize Governor Ivey and her efforts to support public health and what she has done to institute a statewide mask order, to institute other health orders. I believe that her face covering ordinance is largely responsible for the improvements in the numbers that we have seen recently, as we've seen declines in our daily numbers of new cases, declines in hospitalizations, and an improvement in our percentage of tests that are positive. And yet there's still a lot of work to do. There are a lot of clouds on the horizon as we try to negotiate kids returning to school and college kids returning to campus. And so it's not the time for us to quit, but it's a time for us to try more than ever. Obviously, testing is a big part of our strategy. And we are so grateful that HHS has made these resources available to the people in this community and in Center Point and in Tuscaloosa. We sincerely appreciate this ability to bring this testing at no cost to anyone who needs it. And it's just a tremendous boon for us here in the state. So again, let me welcome Dr. Adams. We're very privileged to have him here today. We thank you so much for all you're doing for us. Let's turn it over to you.
Well, good afternoon, everyone. And I want to start off by saying greetings from President Trump, Vice President Pence, Secretary Azar, and the entire task force, including Dr. Birx and Dr. Fauci. They were all very excited to hear that I was coming down here to Alabama. Director Hastings, thank you for the work that you've done. And I want to give a shout out to our elected officials who are here, our commissioners and our mayor, for really supporting what is a locally executed effort to make sure we get people all across Alabama tested. I want to give a special thanks and shout out to your governor, Governor Ivey, and to your health director, Dr. Harris. Dr. Burke specifically wanted me to make sure people here knew that the courage of Governor Ivey in issuing a statewide mask mandate is, in our opinion, the opinion of the task force, very much a part of why we're seeing Alabama turn around its numbers and move in the right direction. And what do I mean by turning around its numbers and moving in the right direction? We think of your risk as a community in terms of red, yellow, and green, like a stoplight. If you have a positivity rate less than 5%, you're in the green. That means you're going to be in a safer position to open up. If you're 5 to 10% positivity, you're in the yellow. That's caution. That means we need to slow down. We need to think about what we're doing. If you're in the red zone, then that's really a concerning sign that you may need to stop doing some things until you can get disease spread back under control. And the fact is, the people of Alabama need to know that you're in the red zone for cases and in the red zone for test positivity. Again, which means we're seeing more than 10% of tests come back positive. But I want you to know that there's good news. Alabama is in the green zone for testing, conducting over 62,000 tests last week. And that positivity rate is coming down. The case incidence is coming down. Hospitalizations are coming down. And these are things that we track on the coronavirus task force. Alabama is the only state in the red where all of the indicators are moving in the right direction. And why is that happening? Well, you heard Director Hastings and Dr. Harris mention this. It's happening because the people of Alabama are taking basic public health measures, the 3 W's. Wash your hands, wear a face mask, and watch your distance, meaning avoid crowded indoor spaces and stay 6 feet from other people. We know if we do these 3 things, we can drive down our positivity rates and get to a place where we safely reopen. Reject the false dichotomy out there. Don't let politics seep into how you view public health. At the end of the day, when you look at Spain, when you look at Italy, when you look at New York, 3 of the hardest hit places in the world, they have been able to drive down their positivity rates and reopen restaurants, reopen schools, have sports again. And I know you all want to see Auburn and Alabama play this fall. They've been able to do it because of public health measures. They don't have a vaccine, no miracle therapeutics. It's good old-fashioned public health and people working together. Worth noting that over 30% of the new cases in the last 3 weeks are in 3 counties, Jefferson, Mobile, and Madison County. And so we want those places in particular to really pay attention to their rates. I want you to know that testing is an important part of the strategy to turn this around, because sometimes people just won't change their behaviors until they realize that they themselves are positive. And I want to take a quick second to talk about a term that we bring up often, but we haven't really, I think, done a good job of explaining, and that's asymptomatic spread. So, this coronavirus strain that we're dealing with, SARS-CoV-2, is actually from a family of coronaviruses, including MERS and the common cold. And if Dr. Harris, where are you, Dr. Harris?
Over here.
If Dr. Harris and I were in a room together and I had a cold, Dr. Harris would know it. Why? Because I'd have a fever, I'd have a runny nose, watery eyes, I'd be coughing, I'd be sneezing. And so it's important to know that based on what we used to know about coronaviruses, most people were symptomatic. And that's why we originally said you didn't have to wear a mask unless you were symptomatic. Well, what we learned in March and April was that with this new coronavirus strain, 50% or more of people, especially young people, can spread the disease while being asymptomatic. It means I could look at Dr. Harris, he could look at me, we could both look fine, and neither of us would know that we had the virus and were spreading it. That is why we now recommend that everyone wear a mask in public when they cannot stay 6 feet or more from other people, because asymptomatic spread is really what's driving the outbreak at this point. As far as this testing site, I want to emphasize that testing is free and available to anyone who can self-swab, including children, regardless of whether or not you are experiencing symptoms. So now is the time to come in and get tested. And people may have concerns about what testing entails, I'm going to self-swab myself right now so everyone knows what's going to go on. You come here to the site. We want you to go to www.doineedacovid19test.com first and register. And then when you come to the site, you'll drive up, they'll ask you some questions, and then they'll give you instructions on how to self-swab. They will give you a kit and a bag, and this kit will contain a swab and a specimen container. They'll ask you to open up the swab. This is what it looks like. You'll put it in one side of your nostril and turn it around 3 times. You'll put it in the other side of the nostril and turn it around 3 times. It does not need to go all the way back into your throat like some of the other tests do. I literally was able to swab myself while doing a press conference, so you can do it too. You take off the top of the specimen cup, you put the swab in, and you bend it, cover it up with the cap, you put it back in the bag, and you hand it to the people here, and they will get your test results. And what we've been told so far is that they will email your test results back to you in 3 to 5 days. But I actually think that in most cases you'll get your test results back even sooner, because I just spoke with Admiral Giroir on the way here, and he has assured me that testing return times are coming back down, and that most places, over 94% of tests in the country, are coming back in less than 3 days. So that's testing. I also want you to know that this pandemic has hit us hard, and we need to prioritize our mental health and well-being. It's okay not to be okay. If you or a loved one are struggling with depression, anxiety, loneliness, substance use disorder, because we had an epidemic of opioid overdoses long before we had an epidemic of COVID, and that is still going on even though it's not being talked about, you can call the National Helpline at 1-800-662-HELP, 24 hours a day, 7 days a week. And finally, I just want to talk about kids in school. And now I'm here in Alabama, and I don't want to make the Auburn fans mad, but I had a conversation with Nick Saban and the Alabama football team on Monday night. A great conversation. And we talked about balancing the pros and cons of trying to get back to some sense of normal in the midst of a pandemic. I want you to understand that for our younger people out there, in-person school, it has definite health benefits. We know that when kids are out of school, they are more likely to become obese. They're more likely to misuse substances. They're more likely to miss vaccinations. They're more likely to die by suicide. Real health harms from being out of school, so our default position should be to try to get people back in school safely. I want to say that again. Try to get people back in school safely. It's not one or the other, it's both. How do we get people back in school safely? Well, we need to think not just about the kids, but also about the adults, the school teachers, the bus drivers, the cafeteria workers, and have a plan for protecting them. We need to think about whether or not these kids are living with someone who is older or vulnerable at home. Vulnerable meaning having chronic conditions like diabetes, high blood pressure, chronic lung disease, because these put you at higher risk for COVID-19. Again, the children are at lower risk for complications, but the adults that they bring and spread the disease to could still get sick and die from it. And the final point I want to make is that the most important determinant of whether or not you can open safely, and I said this to Coach Saban, is the background community transmission rate. As long as you're in the red, you're still going to be doing this very, very, very cautiously, and we're going to need everyone to do their part. The 3 W's: washing your hands, wearing a mask, and watching your distance. If we do these 3 things and drive down our transmission rates, then we can successfully and safely reopen, and we can keep things open. But as you've seen across the country, all it takes is one group of people deciding they're going to have a frat party, one group of people deciding they're going to have people over for a barbecue, and that can turn into a cluster, which turns into an outbreak, which turns into greater community spread, and we don't have college football in the fall. So I want everyone to understand that the power to stop COVID lies in each and every one of our hands. And I want to finish again by saying thank you to the people of Alabama. You are the only state that is in the red that has indicators all moving in the right direction, and that's proof that you're doing the right thing. We need you to keep doing it. We need more of you to do it. Wash your hands, wear a mask, watch your distance, and go to www.doineedacovidtest.com to get tested. Again, you can do it while you're giving a press conference. And now I'd like to turn things over to the local health commissioner. Thank you so much, sir. Appreciate it. And you're going to see here that I'm actually practicing good public health hygiene. I'm going to sanitize my hands because I touched this podium before I put my mask back on, because you want to make sure you're not spreading disease when you touch something. So thank you very much.
Thank you, Surgeon General. We really appreciate you being here and for your support, and we're very grateful for the support from the federal government to allow us to do this surge testing. I also want to thank Commissioner Scales, Commissioner Ammons, Mayor Bricado, yes, over here, for their support in helping us get this site set up, and the one that's going to be starting in Center Point on Monday. And I'm just extremely grateful for all of our commissioners, our mayors, others in our local community that have shown so much support ever since this began. It's been amazing teamwork, unity around this. We haven't always agreed on every detail. Sometimes I've gotten pushback, but I value the relationships that we have, the conversations we have, and all the work that we're doing together to overcome this pandemic. I'm also extremely grateful for our local partners that have worked really hard in this last week getting these test sites set up. It's been a lot of work. We have an amazing team at our local health department that have really stepped up to get this done in short order. I'm especially grateful to my deputy health officer who you heard from earlier, Dr. David Hicks, an extremely dedicated, faithful, tireless servant who's been working very, very hard. I'm extremely lucky to have him working with me and very grateful. I finally just want to say to the public, please take advantage of this huge opportunity we have over the next 2 weeks to get a lot of people tested. It's a huge number of free tests that are being given to us as a community, not just Jefferson County, but the broader community, the greater Birmingham area. We want to make sure that we not only focus on our own county, but our neighbors. So we really invite people to come from other neighboring counties and get tested. And of course, if you're in the Tuscaloosa area, get tested there. Certainly, if you have symptoms, any symptoms that are suggestive of COVID-19, and you can go to the CDC website to see what those symptoms are if you don't already know, you definitely need to get tested. Certainly, if you have a known contact, definitely need to get tested. But because we have this huge resource, the ability to do up to 60,000 tests in 2 weeks, we want people that don't have symptoms to get tested if they have any inkling that they've been in an environment or in a place where they might have been exposed. Large crowds, or maybe there are essential workers that are just dealing with the public a lot. We encourage you to get tested. Surgeon General told you how simple it was. We really encourage you to register and get that done. We've made it just about as easy as you can possibly make it to get this done. So also just ask everyone, spread the word. We want to get as many people tested as we can. If we can do that, we can do the contact tracing, the case investigations, and really get this under control. We have made a lot of improvement, but we still have a long way to go, and this can really help us further drive those numbers down. Our health department has ramped up its capacity to do that case investigation and contact tracing, so we are ready to handle those new cases and get those dealt with. So thank you again, everybody, for all the partnership, and thank you for coming out this afternoon.
We want to say thank you to all of our speakers. At this time, we are going to begin the question and answer portion of our news conference, and we're going to ask Dr. Adams if you'll come back up, and if we can start with any questions that might be specifically for the Surgeon General.
And Dr. Harris, if you want to come up and stand next to me too in case it's a state question. One thing we didn't talk about that I want to highlight is that this is going to be probably our most important flu season of the last 50 years. And it's incredibly important that everyone gets their flu shot this season because the symptoms of flu overlap with the symptoms of COVID. And if we have a bunch of people going into the doctor's office or the hospital because of flu, it could overwhelm our healthcare system capacity. So please, this year, get your flu shot. And remember, go to www.doineedacovid19test.com right now to make an appointment to come out and get tested. It's free, it's easy, so do it.
Dr. Adams, can you talk again how Alabama was chosen and why these tests are so critical in bringing it down? We're already going in the right direction, so people might ask, what else do we need to do?
Well, again, it's critical that the people of Alabama, number one, know that they're doing the right thing and that their numbers are coming down, but know that they are still in the red zone. And we want you to get down below 10% positivity to the yellow zone and then keep it up so that you can get into the green zone. Because when you're in the green zone, then we can feel a whole lot safer about reopening schools, about our ability to keep schools open, about being able to participate in sports, about being able to have even more people dining indoors, and about being able to bring people back to worship. That's something that's important to me and that I know is important to the people of Alabama. The way we do it safely is by lowering transmission, and we lower transmission with the 3 W's: wear a mask, wash your hands, watch your distance, but we also do it by knowing who's positive so we can isolate and contact trace, and we do that when you sign up to come get tested.
Dr. Adams, how quickly is the test result turnaround time?
On a national level, our test turnaround times are under 3 days for over 94% of the country right now. That doesn't mean that we won't have outliers. That doesn't mean that we're even happy with 94% under 3 days. I'd really like to see close to 100% under 2 days so that we can actually act on these in a way that helps us contain the disease. But that said, the turnaround times are coming down. I want to assure people of that. You will get your results back in a timely manner from this testing site. And Dr. Harris, anything you'd like to add to local testing turnaround times?
Sure. As you know, I think everyone's aware, we have had challenges just in our laboratory with having appropriate reagents and obtaining test kits, and so those continue to be challenges for us. One thing that we talked about a little bit is we have been working for a couple of years on a brand new state public health laboratory, which has just finished construction. The move to that is going to be taking place in the next 2 to 3 weeks, moving from the Montgomery area to the Prattville area. There will not be any significant interruption at all in our testing. We've figured out a way to negotiate that, but we do believe that we'll have the ability to even improve the turnaround time beyond what we are seeing recently. So.
One other thing I would want to add is the turnaround time is directly related to the number of cases we have nationally, because we're using commercial labs all over the country in many cases, and the case count locally. The case count nationally has been going down for the last several weeks. That's a good thing. The positivity rate nationally has been going down for the last several weeks. Places like Arizona and Florida and Georgia are seeing their numbers go down, and so that's going to only improve our testing turnaround times further. So I know a lot of people, I've heard the two main concerns people have about getting tested are, how long is it going to take for me to get my results, and is it going to hurt? And I just demonstrated on myself that it is not going to hurt to come and self-swab, and I want you to know that the testing turnaround times are much better than what they were even just a few weeks ago, so you will get your results back in a reasonable amount of time.
If someone has previously been tested but they don't have symptoms, don't think they have been around anybody, should those persons not be tested now?
So the question is whether or not someone who's been tested before should be tested again. You've got free testing available here. We know we've got community spread still going on in Alabama. So if you are at all curious, or if you think you've been around someone who has symptoms of COVID, or you're around someone who you know has had COVID, or you've just been to a crowded indoor space, and I know this happens to us a lot of times by accident, or we want to go out to eat and we think we're going to be able to social distance, and all of a sudden we realize that we're crowded in a line to get into a restaurant. We want everyone to come out and get tested, especially over the next 2 weeks while we've got this surge site here, because a negative test result last week or even yesterday doesn't mean you're going to be negative today, especially if you've been out in public and around other people.
Dr. Adams, I have a question for both yourself and then Dr. Harris on the local level as well, so I'll ask Dr. Adams
Okay.
first. We know there's not a cure-all right now, but some physicians at Yale have been looking at some recent studies, to possibly link vitamin D deficiency and COVID-19. I know it needs some more research, but is this something y'all have been hearing about or even been looking at?
So a question about therapeutics and preventive measures. Operation Warp Speed is really all about using the full resources of the federal government to explore therapeutics and to get 300 million doses of a vaccine available for the American people by the end of this year. We also have initiatives from NIH, FDA, CDC, exploring different therapeutics, and we are in a much better place than what we were in March and in April. The chances that you will die if you get COVID-19 have come down significantly because of advancements in therapeutics, and we're looking into nutrition, we're looking into all sorts of different ways that we might be able to protect you. What I can tell you right now is that from a public health standpoint, the most important things you can do to stay safe from COVID are washing your hands like your mother told you, staying away from strangers like your mother told you, watch your distance, and wearing a face mask. Those are the three most important things that you can do, and anything you do beyond that may help incrementally, but isn't going to overcome the benefits you would get from following the 3 W's. We also have remdesivir, steroids, convalescent plasma to treat you if you get sick from COVID, but I would rather you not get sick in the first place and have to rely on treatments that are still in the experimental phases. We want to prevent you from getting the disease in the first place. Anything you'd add to that, sir?
Sure. No, I would just reiterate that I do believe we have done a better job treating those people who do get sick as our physicians develop clinical experience with the disease. I think that's made a difference, or so they have reported to us. We have been on a number of calls with CDC and with HHS and discussing how a vaccine rollout will occur, at what point, and how that'll be prioritized. And I think we have good plans underway to have that when we have good candidates to do that. So we're confident that'll happen sometime soon as it can be done safely, and we know we have a product that's going to work.
How long will these testing sites be open? Is there a maximum as to how many they can do per day here?
These will be open for 2 weeks, and they're going to be doing about 1,500 tests per site. Yeah, so.
Is that per day?
I'm sorry, per day. Yes, that's correct. Yeah.
And one more, I want to add on to the question that you asked, because we know that COVID-19 is caused by a virus, and there are things you can do to protect yourself from viruses. Again, washing your hands frequently, but also making sure you're eating properly, making sure you're getting sleep, making sure you're getting exercise and fresh air appropriately socially distanced. All these things matter. If you want to take a multivitamin, I'm not against that as Surgeon General. I take a multivitamin. But I would say to everyone, do not take a medication, especially a prescription medication, without talking to your doctor or health provider first. Don't put anything in your body that you don't know what it is or where it came from, especially any prescription medication, without talking to your doctor first so that you can stay safe.
We have time for 2 or 3 more questions at this point.
Dr. Adams, if Alabama does not see a significant drop in cases after this 2-week testing period, is there a possibility that the surge testing could come back to the state?
Well, we are always, from the federal perspective, willing to send support to places that need it and that ask for it. And again, Governor Ivey deserves much credit because she has worked very well with the task force to let us know what she feels the people of Alabama need, and to let us know when she thinks she needs some extra help getting the message out, which is why I'm down here today. So if the surge testing site, well, I'm sure it's going to be successful, because I know the people of Alabama are going to come out and get tested. But if it's needed to be extended and we need to provide federal support for that, then that's certainly something that we are willing to entertain. But here's my hope. My hope is that we can go from Alabama right now is just barely in the red zone, over 10%. I'm hopeful that cases will continue to come down, and over the next couple of weeks, we'll see Alabama get into the yellow zone and then get into the green zone. Timeline-wise, I want people to remember that the measures you take today will be reflected in cases 2 to 3 weeks from now. And then 2 to 3 weeks from that is when you see hospitalizations. And another 2 weeks or so is when you start to see people dying. That is why, unfortunately, we're seeing deaths go up across the country, even though cases are going down, because people are doing the right thing now, and they've been doing it for several weeks. But the deaths reflect what happened 4 to 6 weeks ago.
When you said you spoke with Nick Saban, have you seen the photos of the Tuscaloosa students at the bars? Can we get your comments on that?
Well, my comment is the same that I made to Coach Saban, and that I heard Coach Saban make to his teammates, or to his team members. Everyone needs to understand that we are all in this together, and that you are only as strong as your weakest link. And you can have everyone on the football team doing the right thing. You can have everyone in a school doing the right thing. And if one person decides to be selfish, and I hate to be so direct about it, but decides to be selfish and go out and do something that exposes them to the virus, and they come around these other people, that can ruin a whole football season. It can cause an entire school to close down. So what I would say to the young people is, actually most of them are doing the right thing, but all it takes is one weak link. And if you want to have homecoming, if you want to have college football, if you want to have prom next year, if you want to have in-person graduation and spring break, you want to go to Panama City or go down the Gulf Shores where my family likes to go during spring break, we need you to do the right things now. And we need you to only do it, really, it's not forever. It's just so until we get to a vaccine, which we expect we'll have by the end of this year or beginning of next year. Simple inconveniences allow us more options, but a little bit of selfishness prevents everyone from being able to have the options of doing some of the things that we know we can do.
Thank you, Dr. Adams, and again to all of our speakers. At this time, we're going to wrap this portion of the event. We do want to let you know that Dr. Adams is on a very tight time schedule, so he will have to be leaving, but if there are other elected officials who will be around and available to speak with one-on-one afterwards if you would like. At this point in time, we're going to move into the third portion. Of our conference. Dr. Adams is going to go out and tour a little bit of the site. We ask that if you follow along, that you please be cognizant not to get anyone's face that's being tested on camera, also no license plates. And if the staff that is administering the test do not want to be on camera, they will let you know. So we just ask that you please be aware of that.
All right. Thank you very much.
Thank you.